Perfect. Just getting ourselves last minute set up. We'll see if anybody last minute signs in and joins us. Perfect. So I want you to have available a block of some sort. So even a stack of books might be like this book would. This book would do. Not very good with numbers. What's that? 2 inches? 3 inches? 3 inches. It doesn't have to be very high. If you've got a step stool or like a squatty potty, that could work too. Nothing like, as long as we have a little bit of elevation, that's what we're looking for when we use this little exercise. All right, I am going to give it just a couple minutes. Good. Good. Lots of lower body, I'm gonna say the word ailments, because it's a lot of people said it wasn't pain, but their knee's not working right, or their hips don't feel square, or they feel shifted. So we're not gonna address them all specifically, but what we're gonna do is look at just making sure we're orienting our trunk. Okay, this is Frankie. Frankie's lost a lot of limbs. Orienting our trunk, putting our diaphragms on top of each other, and that puts us in a really good position to allow us to have control at the hip or mobility. So there's a difference between mobility, flexibility, and stability. And if you're liking this video, I've got a presentation on Wednesday all about balance and hips and single leg stability, specifically for curling, and that's happening on Wednesday. You can also just purchase the recording if you don't feel like joining live. Okay, so I'll end up sending a follow-up email to those that signed up for this with information on that, if you'd like to dive in a little bit deeper. So one of the things we're going to look at, we're basically making sure that the body's moving really well, so we can have range of motion at the hip. So if you want to kind of do a little pre-test before we do this, I'll have you stand up, and if you want to video yourself, if you're watching the recording, if you want to video yourself, look in the mirror, just feet about hip bone distance apart. Okay, just paying attention to where you feel your body standing normally. Is it your body weight more on the fronts of the feet or the back? Is it in the left side and the right? More on the inside or the outside? And some people find that they don't know, they've never thought of that before. So it's a win to bring your awareness to where you feel your foot pressures. Maybe you feel your hips. Is one hip turned higher? Maybe do you feel like you've got your hips dumping forward? Are you clenching your butt? Okay, same with the shoulders. So just doing a little bit of a check-in, and this is something you can do at the end just to see, is there any change, or have you brought any more awareness, in particular into the hips? So we're gonna keep your feet on the ground, cross your arms across your chest, and then let your body rotate slowly to the right as far as you can go. Look over the right shoulder. Okay, and then come back into the middle. We'll do the same thing to the left. You wanna keep the feet in contact with the ground. Do that a couple of times each direction. Does one feel better than the other? Do they feel like, does one feel like you're leaning back or crunching forward? Again, just taking an inventory. So any of these exercises, if I haven't said it already, any of these exercises, if you're like, this doesn't feel right, or you need assistance, or you want to get double checked out, pause, you can come back to it. I can do a little Q&A at the end if you'd like, but definitely don't pursue any pain or discomfort. Okay, so keeping it really simple, we're gonna start. I wrote this on here. Good, I want you to start on your back. Okay, because I want you to start on your back, knees bent, feet flat on the ground. I'm gonna show you on the camera. We're trying to take this piece, this muscle that goes below our rib cage, and the muscle that goes in our pelvis. We're trying to stack them on top of each other. So if you're on your back, knees bent, feet flat on the ground, take your hands to your ribs You know, like if you were to tickle someone right along the rib cage, just below the bra strap, if you know where one of those goes. And I've got my thumbs wrapping around the back and my fingertips on top of my ribs. Okay, and I just want you to bring your attention into your breathing. There you go. You can just notice where the breath goes into the body to start. So it doesn't necessarily have to be into the ribs, but just notice if it is or if it isn't. And now I want you to take what you see, deem as a full breath in. Feel the ribs expand and a full breath out. Out the mouth like you're blowing out a straw. Thinking of emptying of air. All the way empty. Even if you think you've got a little bit of air left, keep going. And then breathe into the chest, into the ribs. Relax the belly. Breathe out. Take all of the air out, like you're squeezing out a tube of toothpaste. Okay, breathing in again. The ribs, the belly moves. Relax between the sit bones. This time when you're breathing out, to be efficient at squeezing out that tube of toothpaste, think from the bottom, the belly, then the bottom ribs, then the top ribs. Squeeze out that tube of toothpaste from the bottom. Okay, relax into the rib cage, into the belly, right down into the sit bones. You can imagine the sit bones separating. And then empty that tube of toothpaste. And you'll notice here, your low back might start to flatten towards the ground. Your front ribs might push down towards the floor. Okay. So allow yourself to breathe naturally just for a couple of moments. When we get the low back pushed into the ground here, gently, without clenching the bum, and when we get the front ribs pressing back to the floor, it stacks our rib cage over our hips, and it puts us in a nice, efficient position for us to create and resist movement. So if I get lumbar pelvic tilt forward and I get a lot of tightness in my low back or a lot of tightness in my hip, that's going to cause a lot of issues. It's also going to make it hard for me to move my limbs in particular in that curling position, opening and closing the head. Okay? So thinking about this feeling lying on the back, when you breathe out and you bring your front ribs down towards the floor, how stable you feel in the core, air quotes on the core, in the trunk there. Okay, so we're going to make our way into a seated position. And I just want you to take a sit. If you need to sit down on something like that yoga block just to lift the hips, I want you to feel the sit bones. You can sit on the floor, you can sit on the block. I want you to feel your sit bones. So those two bony pieces, the bottom of your hips there. You feel them right up in there. And then also see if you can feel your tailbone, the base of that, so your coccyx, your sacrum. Okay, so sitting down either onto a chair, onto the floor, onto a little block. Notice here as well, very similarly, are you shifting your body weight more to the right hip or the left? Are you more into the front, into the pubic bone even, the pubic bone here, or are you back on the sit bone? Can we try to even out at least left and right and center ourselves? So if we're going to take our hands back to our ribs and take a full breath in, and then a full breath out, imagine that you're lying down again. So my front ribs are pressing to my back ribs. So I'm stabilizing through the front. So you can breathe in and squeeze out that tube of toothpaste. Front ribs to back ribs. Okay, so I'm not crunching down, I'm just compressing in here. One more time, breathe in, see if you can relax the bum. Don't clench the butt cheeks. And exhale. So I've got this little bit of tension here, but most importantly, I've aligned my ribs over my pelvis. This is going to be important when we go through the next few exercises. Okay. Sorry, this is not staying on. There we go. So we're going to go through those 3 exercises that I put in my Instagram because I want to go nice and slow on those. So already we've got some movement through the ribs, some coordination in the core. So we've brought these pieces together, and now we're going to go through the hips. So what we're doing in the next few exercises, I take Frankie and their leg bone. Okay, this leg bone slots into this fossa here, this little indentation, not the hole, the fossa. Okay, and it's a ball and socket joint, so it's got this ability to roll, and it's got this ability to allow us to shift in through our hips, go side to side, etc. Where a lot of back pain, knee pain, hip pain comes from is when we aren't able to get that motion in the hip, and we take it from our SI, our lumbar spine. Okay, we take it from by pushing pressure out through our belly instead. So we're just trying to be aware of that original orientation while we're doing these exercises, to make sure that the hip motion that we're getting is just this leg bone in the pelvis, in that socket. Okay, so we're gonna get into a bear position or a tabletop position and put your right knee on the block. And then just with your upper body, if I was lying down on my back, I don't want Kim Kardashian beauty, okay, but I also don't want to drop my head. So when I laid down on my back and I took a breath in, I went up into my chest, and when I breathed out, my front ribs went to my back ribs. I'm not crunching, keeping a nice long spine. Okay, so trying to be aware of that while you're doing this hip exercise is going to be helpful. Okay, so from here, this muscle here is lengthened. So if I were to shift my body weight to the right just a little bit and relax my bum, I might feel this right hip, outside the right hip, feel lengthened. Okay, and this is where it becomes active. I'm going to push down through this right leg to lift up the left hip. Now, some people have more range of motion here than others. So it might be an inch or two up and an inch or two down. Inch or two up, inch or two down. Okay. So I want you to move the leg up and down nice and slow. Now, I like to do knees as close together as possible. Bring the camera down, go up and down on your own time there. Nice and slow as possible. I'm lifting and I'm lowering. Now notice that this hip bone is staying over the knee throughout. Lifting and lowering versus side to side. This is lumbar, low back motion versus lifting and lowering. Now we're going to do 2 sets of this, so stop at 10. And we'll go to the other side. Now, most people, the right side's a little bit easier at that. Does a little bit of a better job at lowering down and lifting up. Okay? Whereas the left can a little bit struggle. Okay? To the point that you can see that I like to shift into my left here. I'm not as strong. Okay, so even if I have to walk my hands to the right a little bit to help support that body weight over the left. Okay, lifting and lowering. You get a prime view here in a second. I'll show you from the back. Please, lifting and lowering. That's nice and slow. The slower you go, the more of a stretch you feel, which is going to allow you to actually get more of that. You get length from that, which is allowing you to get more contraction from that. Perfect. Okay, so the next exercise is we're going to do a split stance, rock and roll. We're going to get into a split stance position. If your back knee needs something underneath it, you could roll your yoga mat up. Okay, you could put a pillow underneath. Maybe something to give you a little bit more stability here. Okay. Now, if you think back to lying on the ground, we don't want to be dumping the pelvis forward. If you imagine my hips are a bucket, I don't want all my water to dump forward. I also don't want it to go all the way back, so I'm going to try to find that midline. So this is where taking a nice full breath into the ribs helps. And then we can squeezing out that toothpaste. Front ribs to back ribs. Okay. So I'm stacked over this back knee to start. And I challenge you actually to not clench this butt cheek too much. See if you can not relax and hang out into the joint, but not hold too much tension. We're not moving. It doesn't need to be max tension here. Okay, I'm going to just move this down so you can see my foot. So you're in this split stance position. Already, if you're used to dumping the pelvis forward, stacking the ribs over the pelvis might feel already a hip shift, a stretch. Okay, so now what we're going to do is we're going to shift into this left hip. Okay, so I want you to take your hands on your hip bones. You know those bones we get on a table? Short people, you know what I'm talking about. okay? And if I turn my hips to the left, see how that pushes my left hip back? And if I turn my hips to the right, see how that pushes my left knee forward. So turn the hips to the left. Now again, remember I have lots of movement, so if it's only a little bit of movement for you, don't worry. So I'm turning to the left, and I'm turning to the right. Okay, so keep that exhale, that squeeze of the toothpaste, those front ribs to back ribs. And my challenge for you is actually to relax the toes. Okay, let the knee, if you turn to the right and the knee wants to go over the left big toe, let it. If you pull back, okay, and you want to turn the shoulders with it, that's fine. So we're shifting and rotating. And a lot of people, especially on this left side, are not used to getting this much range of motion at the hip, this left hip shift back. And we're going to make this a little bit more dynamic on the second round. We're going to do all this twice. So I'm actually, notice how I'm getting that left knee over my toe. It's fine. You can challenge yourself, bring the foot in. Okay. And we're going to do this on the other side. Okay, so stack. What I'm actually stacking is I'm taking my temples, my breastbone, my sacrum, and in this case, over the knee. Yeah, good. Okay, so take a full breath in. Bring the chest up. And you can take your hands to your hip. You're opening to the left and turning to the right. So when my right knee's forward, when my right foot's on the ground and I turn to the right, I'm bringing my left hip forward, my right hip back. Okay. When I turn to the left, I'm bringing my left hip back, right hip forward, and my shoulders are going with it. So notice how the rib cage and the pelvis move together. Okay. So go through, we're going for about 10 rounds here. See if you can do this without clenching up into the butthole. Letting that knee come inwards if it likes. Trying to keep that foot flat on the ground. We could do a whole entire session on what that foot should be doing. Okay, perfect. Yeah, good. Golfers, okay, right-handed golfers, when I turn to the right, this is my backswing. When I turn to the left, this is my follow through. So think about what the hips need to be able to do at the hip. It's not just me turning. If I would exaggerate that turn, I'm turning over that leg. I'm opening up one hip and closing the other. Okay, we're gonna come into standing and do a little balancing exercise. So I encourage you to come to a wall. Peek into the closet here. Come to a wall or a table. Okay, we're gonna get into an airplane position. So balance on your left foot to start, and then the knee. You don't need to see my head. Just know that my head's not poking forward. I've stacked the temples, the breastbone, the sacrum, and we'll just use the front of the heel as a landmark. Okay, so what I want to do from here, hips square. So notice if your hips start, turn one way or the other. Try to square them, in this case, to the camera. Okay, and have this right knee bent. And then I'm going to push that right knee back. So I'm not getting into a huge airplane. If you're big on yoga, you could get into a full airplane here, as long as you're not compensating into the hips. So we're holding onto the wall with one hand or the other, whatever feels right for you. We've hinged. Okay, and in this case, we've actually pushed this left hip bone back. And then I'm going to drop the right knee down, turn my hips to the left. Lift my right knee up and turn the hips to the right. Okay. So I'm in a hinge, right hip down. See how I turn over the left, right hip up. Very similar to that quadruped where we lower down with the left, with the right knee, and we lifted. But now we're adding in this turn. So this left glute stretching when I turn to the left, contracting and lifting when I turn to the right. Turn to the left. Turn to the right. Notice if you're gripping your toes. Let's go 3 more. We'll do the other side. Okay, so that glute muscle should feel like it was stretched and then contracted. Oh yeah. Okay, so right leg. I'm not clenching my toes. I'm trying to put my temple, which you can't see, my breastbone. You can take a here. I'm gonna hinge back. I'm staying over this right leg. The knee is gonna go down as I turn to the right. And then the knee is gonna come up as I turn to the left. And again, everyone's got a little bit more range of motion. And I encourage you this time to be holding on to something. Let that hip drop. See if it helps to see from the back. Say 3 more. Next set, what we're gonna do is we're gonna add in the breathing. Good. Okay, so shake out those hips. So if you think about it, when I breathed in and I breathed out, give me an opportunity to orient my pelvis, my ribs, and my pelvis. Okay, so if I hold my breath, I might start to lose that ability to maintain that good stacked position. So we're going to go back to the table. Back to our table with the block. I'm adding to it. 2 things I'm adding. Okay, so number 1, we're adding the breath. We're going to use the breath here to provide us a little bit more space and length through the pelvic floor, as well as a little bit more stability, because every time we exhaled, we got that nice stable stability through that trunk. Okay, so back into your tabletop with the right knee lifted. We take a breath in, and a breath out. Show you from the side. Okay. And I want you to inhale as you push down and lift up the hip. Sorry, inhale. Sorry, let me start that over. I went too fast. Okay, so we're lifting and lowering the knee. And I want you to experiment with exhaling when you lift up and inhaling when you lower down. Okay, exhale, inhale. Quiet breaths in and out the nose. Okay, if you like a little bit more, we're going to go into a fire hydrant. So when you exhale, lift the knee up, you're going to pee on the fire hydrant to the left. So I'm really pushing down through the right knee, and then I'm going to bring the knees together and breathe in as I lower down. So I'm lifting and peeing, getting a lot of motion through, a lot of control through those hip external rotators on the right. But when you bring the knees together, squeeze the legs towards each other. Yep. Lifting and lowering. If you feel this in your low back, you're lifting up too high. You might just be trying to extend through the low back. So wherever, this is all about what's happening at the hip. Right side is not as good at this. It's a lot tighter into our right hip. This is for both right-handed and left-handed curlers. Just most people are tighter in that right hip. Okay, let's go to the other side. Let's try this again. So we inhale when the knee goes down. Relax the pelvic floor. Exhale. We're going to lift. Inhale to lower. So relax your bum. Exhale. Inhale. Okay. Imagine there's a roll of pennies between your inner thighs. Sorry, pennies are 1 cent. If anybody has around before. Money. Okay, and then we're going to add in that fire hydrant. So roll the pennies up, lift, and pee on the fire hydrant. And you might already find left side's a little bit easier. A little bit easier to find stability on this left, and that's good. Okay. So what this is doing is teaching our hip bone to shift back. We're also giving those external rotators a chance to be a stabilizer. So if you're a left-handed curler and you struggle to get that left hip back so you can square the hips, Same thing with right-handed curlers. This exercise is really important for you. If you've got knee pain, back pain, it's a good one to work on stabilizing through the core. So let's get ourselves back into that split stance position. And again, I'm adding the breathing and I'm adding an arm motion to that rock and roll. Okay, so stacking, temples, breastbone, sacrum, relax your bone, relax it, release. Don't hold it in, let it go. Okay, relax your toes. Let's do a full breath in and out. Already, if I were to breathe all the way out, you might even find that this hip gets a chance to relax. We've used the exhale for that stretch. Okay, so let's start. We can push that left knee forward as I rotate to the right. And I can pull that left hip back as I rotate to the left. So I'm getting a hip shift to the left. Now let's add in the breathing. We can breathe in as we rotate to the right. And exhale. We're getting inner thighs here, right up into the groin. So a lot of curlers live in this more open position and struggle to get that left hip back. And I see this when you're throwing a rock. You might have everything lined up, knees and shoulders, but your pelvis is to the right as you're sliding, even if your shoulders have overturned back. Okay, so that ability to push that hip back into the socket. Back into the socket is really important. Okay, sorry. The next piece that we're adding to this, you can take your hands off if you're feeling crazy. You're gonna reach over that left knee. Okay, let's go. Let's exhale as we reach forward. Just switch it up. And inhale as we reach back. Exhale as we reach forward. So we're getting that low abdominals. Inhale as we reach back. We're relaxing through that left hip. So what we're doing is we're giving you more movement options. So regardless if you're righty or a lefty, we're making sure we're improving that external rotation and internal rotation on the left. Phenomenal. Okay, we'll go to the other side. Right leg lifted. Okay. Back foot could be pointed or tucked. It doesn't matter. It doesn't matter for my purposes. Take a full breath in, full breath out. Okay, one thing we haven't talked about is the role of the hamstrings. You could think of using that heel to pull the body forward with the hamstrings. But not going to talk about today. Okay, so we can rotate over the right, poke that right hip back. Okay, and exhale, inhale, reach forward. Turn to the left. Exhale to the right. Inhale to the left. Maybe get real tense in here. You might feel wherever you feel that tightness. Okay, if it's when you're turning over, so if I feel tightness in the hip here, I'm not used to internal rotating. If I feel tightness when I'm opening up my right hip, it could be because I lack external rotation to give me that position and I feel a tightness there. Okay, so most people, they're going to feel a tightness on the inner thigh there because this is not allowed to open up. It doesn't have that movement option. Okay, so let's switch it up. When you bring the knee forward, you're going to exhale, right hand forward, big reach. And then inhale, left hand comes forward, right hip comes back. Exhale and inhale. So we're working all in this hip. It's a really big area and it really depends on what part of the body you have tightness, lack of stability, or lack of range of motion. Stability on that exhale, length and relaxation on that inhale. All right. Go through the standing airplane there. So hopefully that feels good. And the left and the right might have felt different, and that's normal. Okay, so we're just teaching you how to get more movement through the hip. Okay, so now we're going to go back to that standing airplane, dynamic airplane. Okay, something to hold on to. Whoops. Okay, something to hold on to. I always chop my head off in these videos. Okay, I want to be able to see my feet. Okay, so let's do left Right foot on the ground, left knee lifts, take a full breath in. You can notice standing here, do I sag into this hip? Can I keep them level? So we don't want to just sag here. That's not the same as, sagging is not the same as turning. There's a difference between turning and sagging. One's passive, one's active. Okay, so make sure that your hips are level. Okay, I'm gonna push this left, leg back, but really I'm pushing my right hip back here. And however much of a hinge you'd like to get into. And I'm gonna turn my pelvis to the right, and then I'm gonna turn my pelvis to the left. Okay, we can add in the breath. I prefer to breathe in when I turn to the right, so this right side can open. Exhale, stability to the left. Inhale to the right, I'm getting inner thighs. Exhale to the left, I'm getting outside that glute. Okay, put the body weight forward into the very front of the heel, so you start to feel what's called midfoot. You start to feel that arch. Let me see if you can relax your toes. Let's into the hips today. Last one. Again, if you feel it too much in the back, the sides, inner thighs, you might just actually be turning too much, trying to get too much motion where your body doesn't have it at the hip. Okay, left side. Take a breath in. Breath out. So we hinge back. Yes, my right knee's poking back, but it's my left hip shifting, and I'm trying to keep my hips parallel, so I'm not just sagging. And I'm gonna turn to the left and turn to the right. Turn to the left, turn to the right. Breathe in, breathe out. See if you can relax the neck, gently place the tongue on top of the mouth, the roof of the mouth. You do this without clenching your toes. Good job. Perfect. It's a good way to take inventory of what parts of the body you feel this. Is it only in the right side? Is it only in your inner thighs? Maybe your feet are clenching. Are you holding tension in your neck? Are you struggling to keep that orientation? Okay, all these pieces move together. So one of the things that I like to focus on is making sure you have movement options. We're gonna come down to the ground here. Is that you have movement options. So if you lack range of motion, even as a right-handed curler, if you lack this ability to rotate through this right hip, it's still going to affect you, because when you're in the hack, okay, I need to have that ability to poke and shift into that right hip. I'm not turning as dramatically in the hack, but there is a rotational element at the pelvis when I go from my right hip and then into my left hip. And I make sure that I get my left hip back to keep my pelvis square versus opening while I slide. Okay, a big hallmark is people just kind of leaning into the hip instead of bringing that hip back. And look, a lot of the European teams, this foot, this knee is driving back into the hip. We've moved away from this very open pelvis, open knee, open ankle, okay, putting a lot of opening back here. We've moved away from this, and we're moving towards more of a stacked parallel position. And one of the key pieces that I see in all of the top players, I don't think I've seen a top player that couldn't do this. They have both hip bones very parallel to the ground. The trailing leg is not dropped, and they're not shifting into this leg. They have this ability to hip shift, and it starts with that orientation at the beginning. So all these three exercises are really good for teaching you to give yourself those motions so that when you get into the hack, you have a chance to shift the hips. We have a chance to hold yourself in that position while you're throwing a rock. We're gonna end with that standing rotation one more. I just wanna see how people's hips feel. I know I said we were going to the ground, but I didn't go up to my watch. Okay, so same thing, you can stand back up on your feet. It might not be too much of a different from the feet, but actually notice how the glutes feel. Are you holding as much tension as before? Do you feel like you got a little bit more movement through the ribs? Feel a little bit more stable in the pelvis? And you can cross your arms across your chest and very slowly see if you can rotate to the right. How does it feel? If you're looking in the mirror, does it look any different? And then very slowly go to the left. So we're thinking, I'm looking at your feet, what's happening at your feet? I'm looking at your knees. I'm looking at to see if you can actually rotate the pelvis and the ribs and the shoulders and the head. When I turn to the right, am I actually getting my body weight over the right foot? Or am I shifting it to my left to do it? Am I poking the hip back to do it? Same thing when I go to the left. Can I keep my body weight over that left? All these things I'm not expecting you, of course, to be able to fix yourself, but they're things that you can think about. Do I have hip range of motion? Do I have stability through the feet? Okay, wonderful. All right, hope your glutes are feeling good. I have a feeling some of you are going to message me saying you felt that. Hope things felt pretty good. Any last questions? Anybody have anything? I did mute a couple of you just because you want to unmute, you can. I think we're all good. Thank you for those that showed up live. It's wonderful. And thank you to those that are obviously catching the recording on a long weekend. You're welcome. Perfect. Yes, if you have any questions, send me a message. I'm just going to hit stop. Oh, and Better Balance happening on Wednesday. If you'd like to join, it's not too late. And of course, you can catch the recording. So if you happen to see this, later than May 25th, then you can still access that recording.